grab a seat. Look, I know this upcoming anatomy exam looks incredibly intimidating with all its seemingly impossible Latin words, but trust me, we've got this. Think of me as your personal study buddy today. Let's break down this cheat sheet in this explainer together so you can walk into that exam room with absolute, total confidence.
So, if you're feeling completely lost or overwhelmed by all these directional terms and plans, you definitely aren't alone. I mean, it kind of feels like learning a totally alien language, right? But here's the secret. If you stop trying to just memorize a flat list of words and instead start thinking of the human body as a literal 3D map, the whole system becomes incredibly logical and way easier to digest.
Okay, let's lay down our foundation first. By definition, anatomy is the scientific study of the structure of the human body and how its various parts relate to one another. We aren't just looking at isolated organs here. We're really looking at how everything fits, connects, and interacts within a complex living system.
So, here is our game plan for today's study session. First, mastering anatomical planes, then navigating directional terms, moving into depth and body linings, and finally, clinical patient positions.
All right, part 1, mastering anatomical planes, or, as I like to call it, building our 3D grid. In anatomy, we always orient ourselves from the exact middle. So the absolute first one you need to memorize is the median plane. This is the vertical slice passing longitudinally right through the center of the body, dividing it perfectly into equal right and left halves. It effectively defines the midline of your head, neck, and trunk. Now, layering in our other standard sections. The sagittal plane, that one just runs parallel to the median plane we just talked about. Then, the coronal or frontal plane intersects it at a right angle, dividing the body into anterior and posterior parts, basically front and back. And finally, chopping horizontally right across the middle, we have the transverse plane, which cuts the body at right angles to the longitudinal axis. Now you might be wondering, why do we even need to know this grid? Well, we aren't just learning this for a multiple-choice test. In practice, these anatomical planes perfectly correlate to standard radiographic imaging views. Seriously, when you look at a transverse radiographic view of the head, like a CT or MRI slice, you're looking horizontally right along that transverse plane. You're effectively looking straight down or straight up into the body's cross-section.
Moving right along to part 2, navigating directional terms. Let's set up our compass.
The best way to do this is to pair up our opposites to make them much easier to memorize. First up, anterior, also known as ventral, which just denotes the front surface of the body. Think of the sternum being anterior to the heart. On the flip side, posterior or dorsal denotes the back surface. For example, your brain is posterior to your forehead.
Okay, moving vertically on our map, we have superior and inferior. Superior or cranial refers to structures nearer the vertex, which is the very top of the cranium. Inferior or caudal means a structure is situated nearer to the sole of the foot. And fun fact, the word caudal literally translates to towards the tail region.
Now, if we map these relative positions specifically to our limbs, proximal means a structure is in close proximity, or closer to a limb's point of attachment to the trunk. Distal means it's situated at a distance, or further away. So your shoulder is proximal to your elbow, but your fingers, those are entirely distal to your wrist.
Here's a super handy mnemonic trick to help you memorize our next pair. Just lean on the Latin roots. Ipse means self or same, so ipsilateral means two structures are on the very same side of the body, like your left arm and left leg. Whereas contra means against or opposite, making contralateral mean structures are on opposite sides, like your left arm compared to your right arm.
All right, part 3, depth and body linings. Time to look at the layers of the body.
So the absolutely crucial thing to remember here is that these depth terms are entirely relative. Superficial just means near the outer surface of the organism, like your skin, while deep means, well, further away from the surface. For instance, your muscular layer is deep compared to your skin, but it's actually superficial when you compare it to your intestines. Make sense?
Now don't confuse general depth with the linings of body cavities. Let's use our Latin roots trick again to lock this in. Visceral is associated with the internal organs or flesh, so the visceral peritoneum is the lining that physically shrink wraps an organ, like the stomach. Parietal, on the other hand, strictly means wall, so the parietal lining is like the wallpaper covering the inside wall of the body cavity itself. And we made it to part 4, clinical patient positions. Let's actually apply all this vocabulary to the real world.
First up are the recumbent positions. Recumbent simply means lying down. If you see RLR on a chart, that's right lateral recumbent, meaning the patient is lying completely on their right side. LLR, or left lateral recumbent, means they're lying on their left side. You are going to see this terminology constantly in clinical scenarios.
Another incredibly common clinical scenario is the lithotomy position. In this position, the patient lies supine, which means totally flat on their back, with their buttocks right at the edge of the exam table. Their hips and knees are fully flexed, and their feet are securely strapped into position.
Finally, let's contrast two very different therapeutic positions. Fowler's position is when a patient is sitting straight up or leaning just slightly back. It's often used to help patients breathe a little easier. We contrast that against the Trendelenburg position, where the supine patient is tilted so their head is actually lower than their feet.
And just like that, we did it. You successfully mapped out the human body's planes, directional terms, and clinical positions. You are totally ready for this exam. But here's my final thought for you to chew on. Now that you have these navigational tools, how will you actively apply this anatomical 3D map the next time you're faced with a real-world clinical scenario? Think about these terms the next time you look at a medical chart or even just a standard X-ray. Happy studying, you're going to crush this, and I'll catch you in our next Explainer.